Hi, my name is Dr. Bowen. I'm a fellow physician here in Toronto, specializing in geriatric rehab, based in Toronto and Providence. So the idea behind Care Umbrella is simple. So we already know these things, so I'm going to split through. So we know what dementia, most of us will be affected by dementia by now. Most of us know someone who has dementia, has memory problems. We ourselves have some memory problems. We sometimes forget things. We forget the instructions given to us. How many of you have parents? You may give them a simple instruction on how to use a VCR, how to use a microwave, and the next thing you know, they ask you the same question again. Like, I get that constantly. So the one thing that we found out, and also from my rehab work, is that dementia patients, they have problems remembering things, which is part of the disease. And that's a problem, because for dementia, we know that lifestyle changes, exercise, taking your medications regularly, keeping memory stimulation, having these memory triggers are very vital to keep a quality of life, to be independent, to stay at home. So our goal with Care Umbrella is basically to assist persons living with dementia to continue living independently and engaged with the world around them. So what do they need to do? They need to, if they're going to live at home, they need to know how to cook food. They need to know to take their medications. They need to possibly check their blood pressure. For instance, from my rehab perspective, they should be doing their exercises, right? And also memory in terms of pictures. Like who is this person, right? Some people will not understand who this person is. But imagine if they could get these triggers to give them information about what it is. So how do we do these triggers? So we have different ways to do this. And for us, we chose NFC. That's the start, the simple technology. So all we do is use our phone to scan on NFC tags, which are proprietary. We've just made it so that it's easily recognizable, all these tags. And then what we do is using our ecosystem, which is not an app, it's basically web-based. It's easy to program. So anyone, your loved one, yourself, or even the caregiver, thank you, can actually go onto our site and easily program these tags, which are already pre-coded. So for instance, you could have actually someone, let's say the husband, right, logs onto the site, they know the number of this code, ID, and they say, "Hi honey, this is John, how's things going?" They could leave a message every day. As a physician or a physiotherapist, you can leave a message for them with the same thing. Log onto the website. They don't have to go home, program it, and do it through our portal. And we'll show you the portal more in detail as the time is running out. And our goal is also to keep researching this, right? Because our initial idea is to make sure that these devices actually work for people. It's not an app. We don't want to create a one-off thing. We want to make sure that what we're doing is going to eventually help these people grow, and also as the dementia progresses, to work with them. Thank you. So our goal at this time is basically we're doing early studies, and we're giving out phones and tags to see how patients are actually using them in the homes. And then what we'll do is we'll advance it, and we'll try to work with organizations and research facilities to see how this will actually help them down the road. And if you have more questions, we'll talk. We're right here to talk. And sorry, that's Steve, our development, and Omar, he's our design lead and NFC procurement.
Great job.